Today on Upfront, the new Republican plans for welfare reform, drug testing people who get unemployment, and restricting choices for folks using food stamps. We'll hear the pros and cons today from Republican Senator Dewey Strobel and Democratic Senator Lena Taylor. Then 2016 and the Democrats. The editor of The Nation, Katrina vanden Heuvel, on why a bigger field would be a good thing for Democrats. Plus, are we getting closer to a deal for a new arena in Milwaukee?
Covering the issues important to Wisconsin. This is Up Front with Mike Goucher.
Hello again, everyone, and welcome to Up Front. Some big changes could be coming to government assistance programs used by hundreds of thousands of state residents, programs like food stamps and unemployment insurance. Assembly Republicans held a hearing last week on several bills being considered. One would require people to receive unemployment insurance to take drug tests. Another would restrict the kinds of food that could be purchased through the program known as Food Share. For instance, no shrimp, lobster, or crab. And a third bill would require people who receive Food Share to show a photo ID for their benefits. Republicans say they are trying to reform welfare and eliminate fraud. But Democrats have countered that these measures shame people who receive government assistance. We're talking about the proposals today with Republican Senator Dewey Strobel of Saukville and Democratic Senator Lena Taylor of Milwaukee. Senators, thanks to both of you for being with us today.
Thank you, Mike.
Pleasure.
Senator Strobel, you feel strongly about this legislation. Let's begin with the drug testing for unemployment insurance.
Sure.
Why do we need that in Wisconsin?
Well, I just got done with a campaign, and I'm also a small businessman. And what I'm hearing more and more in this state is that there's jobs out there. There are jobs out there. And what I'm hearing is it's becoming more difficult to fill those jobs oftentimes. And one of the reasons why it's more difficult to fill those jobs is because so many people are showing substance abuse problems. And that is something that just holds our society back, and it just doesn't allow people to participate in the success that this country can provide to people. And really what this is all about, this isn't punitive, it's not criminal, it's nothing of the sort. But what it is, it's a mechanism to get people help, to get them counseling, to take them from a place where they abuse substances to a place where they don't. Because we all know that their path to success is going to be a much better one if they're not a substance abuser. That's what this is all about, Mike.
Senator, he says it's about helping people. What do you say?
Well, I think the senator, when he was on the campaign trail, maybe didn't have an opportunity to read the report from the Department of Health Services that was done even previously to talk about mental health being a challenge in our state. When people are potentially using drugs, more than likely there's a deep-rooted issue. And that issue, I would argue, probably revolves around mental health issues. I don't disagree with the senator. I don't think anyone does, that we want to address fraud in the system, but this isn't about addressing fraud. This is about being punitive. This is, not compassionate either, in the sense that, one, we have food deserts, we have individuals who have hunger issues, and now what you're doing is saying, you're not going to be able to get food if you have a drug problem. And I think part of my concern with that is it would be fine if we knew that we had an infrastructure to provide services for people. That report told us that we don't have the services on the ground, not only for mental health, but also for addiction issues.
Senator, one of the things I've heard from people who oppose this say, why not for everybody who gets government assistance? If we're giving government dollars to people, why not require drug tests of other people? Why just poor people?
Well, we're not. That's not what it is. And this is a statewide problem. This is about a drug problem. This is about substance abuse. That's what we're dealing with. And really, there's two different bills out there that I think we need to distinguish between. One of them is regarding unemployment insurance. And that's when you go on to unemployment insurance, that you'll be screened. Take a questionnaire. And if you indicate a high propensity for drug use or substance abuse, that then you would then be tested. Now what happens is once you're tested, if you pass, fine, you're on your way with your unemployment benefits. If you refuse, well, then you're really not helping out in the situation, because ultimately we know that the only people that are getting tested under this program are people that have been identified as people who have a substance abuse problem in the past, or who are looking at employment where there's a very high likelihood that they are going to have a drug test to do that job. But again, if you are found where you are a drug abuser, you will get help. you will get counseling, you will get help, and you will continue to get your UI benefits. You will continue to get that unemployment insurance benefit. So nobody's getting kicked off of anything.
Right.
This is all about help.
I actually think that the senator may have, good intentions. But when we spoke to the Secretary of the Department of Workforce Development, none of what the senator said was outlined.
You need to read the bill.
They have no idea what guidelines would be put in place. In addition to that, when you talk about the services that are available, this is a report that was done by the Department of Health and Human Services. This isn't Senator Taylor talking. And so I think the senator might have great expectations about what can be done, but on the ground it's not the reality. And then the last thing, the individuals who are getting unemployment compensation, Mike, it's their money. And so, I don't know. This seems like more big government and, a nanny state to me.
Let me get into this discussion about changes in food share and wanting some restrictions on the kinds of foods you can buy. So I think the argument is that you could have more nutritional food going to people who are using food share, but also IDs. I want to try and get to this all at one time. Why do we need that in food share? What is the problem? Is it fraud? What are you trying to get at with that proposal?
Well, with the photo ID,
Yeah.
with the photo ID, there is fraud in the food share program in using the EBT cards. And it's very simple, Mike. All it does is it puts a photo on your EBT card, because we all know there's a secondary market in these, and it's to be sure that when that EBT card is awarded to that individual has the benefit of the purchasing power that's on that EBT card,
So
that
it's
it
a fraud
doesn't go to
measure.
someone else.
It's a fraud measure. He says
Pretty simple. A photo ID.
And do you think there's no fraud in the food share
I don't
program as it exists today?
I don't think there's anything that isn't individuals who take advantage of the system in an inappropriate way, no matter what that is, no matter if individuals are flying a plane or whether individuals are using an EBT card. However, I think the issue that's more important is how practical is what we're talking about. So for the parent who sends the child to the store, that creates a problem. But I don't know that is the solution, and I surely don't know saying what's for dinner. I'm not going to call up the senator and say, Senator, what's for dinner? And I don't think that we should be micromanaging the type of foods that people can eat. I mean, who doesn't want people to buy cheese in the dairy state? I mean, all kinds of cheese. This is the kind of stuff that this bill does.
It's supplemental nutritional assistance. That's what it is. And it's intended that 2/3 of that be put towards good food groups, nutritional foods. 1/3 you can do whatever you want with. But when it's assistance to be in that regard, to provide for your family, you want to make sure that you're buying foods that are healthy. I mean, eating healthy is not it's a nonpartisan issue. So eating healthy is certainly something we want to promote. I think everyone wants to promote that. And it's just a simple thing. I don't think most people, it will even affect them, because I would expect most people with 2/3 of their SNAP card do purchase healthy foods. That's all it is. It's
Senator,
not a big deal.
let's support urban ag instead. That'll support healthy food and nutrition.
All right. I'm going to have to wrap it up there. We've got a lot of things to talk about, but a fairly short period of time to do it. I want to thank both of you, Senator Taylor, Senator Strobel. Thanks very much for being
Thank you
with
very
us
much.
today.
Always a pleasure.
You bet.
Thank you.
We want to know what you think about some of the changes proposed for public benefits. For instance, should there be drug tests? You can tell us by liking and sharing Upfront on Facebook. Coming up next, the race for 2016 president. From the Democratic side, there's a new candidate in the field. And is Hillary Clinton the inevitable nominee, or could her candidacy be derailed? I'll ask one of the leading progressive voices in the U.S., journalist and pundit Katrina vanden Heuvel. That's when Upfront continues.
Up Front with Mike Gousha, brought to you by the American Transmission Company.